February is American Heart Health Month. We're going to be wearing our red tomorrow. According to the Cleveland Clinic's 2018 Heart Health Survey, a majority of us know little to nothing at all about heart health. What are we doing wrong here? We talk about it so much. For more and to help us learn more about it, let's talk to Dr. Emer Joyce from the Cleveland Clinic. Good morning, doctor.
Hi, good morning. Thanks for having me.
So what don't we know that we should know?
Wow, you know, that's the best place to start. I think the survey covered that most Americans, there's a need for a lot of further education about their heart health, and particularly on how to recognize and respond to heart emergencies, such as heart attack and cardiac arrest.
Okay, so what do we do? What signs do we look for, and what's the, I guess we call 911, but I know a lot of people don't do that.
Absolutely. Well, I think one of the first things is being able to recognize the symptoms of a heart attack. We talk about typical symptoms that I think most people are aware of, such as a sudden onset of chest pain or pressure, often described as a squeezing or a tightening in the center of the chest, which can travel or radiate to one or both arms, up into the jaw, or even into the back. Sudden onset of difficulty breathing or shortness of breath can also be a typical symptom. But it's important to remember, particularly in certain groups, patients may have less typical symptoms of a heart attack, things like nausea, vomiting, pain in the stomach area, or heartburn, sweating, palpitations. These may also be indicators of a heart attack in certain populations. And in order to help people know how to better respond appropriately if they suspect that they or their loved one is having a heart attack, Cleveland Clinic have actually developed an acronym to help people remember these key steps, as you mentioned. The acronym is known as SCAN. S-C-A-N, and if I can, I'll go down through each of the individual components of the acronym. S stands for symptoms, following on from what we just talked about, remembering both the typical symptoms and, depending on the situation, the less typical symptoms. The C stands for call 911. Just like you mentioned, the survey showed that most people do know that this is the first step, but there's still those that think it's okay to drive themselves to their doctor's office or to the ER, but no, you need to stop and call 911. The A stands for aspirin. If you have an aspirin to hand, please chew it rather than swallow it. 2 baby aspirin or 1 full dose aspirin. And this is because aspirin can inhibit platelets, some of the blood cells that are causing the heart attack to progress. The N stands for nitroglycerin, or a nitro pill, as it's commonly known as. If your doctor has prescribed this for you before, then go ahead and take a nitroglycerin pill under the tongue while you're waiting for emergency personnel. So this completes this acronym known as SCAN, which we've developed, as I said, to help people remember the steps quickly if they suspect that they or their loved one might be having a heart attack.
Doctor, you mentioned aspirin. A quick question for you. If you're healthy, should you still be taking a baby aspirin every day? Is that a good preventive measure?
So this is a very important question to bring up with your doctor, with your cardiologist or your internal medicine doctor. You know, there are certain risk groups. It involves assessing your risk factors, knowing your blood pressure, your cholesterol, your family history. Are you a smoker? Have you had heart disease before? It's really a sort of a heterogeneous field, and there's no one rule fits all. So my best piece of advice would be to say, please, if you're wondering, should you be should you be taking an aspirin, to please discuss that with your healthcare provider and review your particular risk factor profile.
Gotcha. I thought you might say that, doctor. I didn't know if it was a simple yes or no, but I suspected it wasn't. Dr. Emer Joyce from the Cleveland Clinic, thank you. Good information this morning.
Thank you very much. Yeah, and just to reiterate, for more information, if your viewers could go to clevelandclinic.org/loveyourheart, that'll provide a summary of the survey and some of the topics we talked about.
Absolutely. Thanks, doctor.